Let's just see here. See who's on. Hello, hello. Thanks for joining today for my very first webinar on low back freedom and tips and tricks in order to help those who are suffering from chronic low back pain, degenerative disc disease, failed fusions, and all of the above, help live a happier and healthier life, free of medication, free of painful surgery, and lots of injections into the SI joint and low back, okay? So let me share my screen here and get this going. All right. So what are we here to talk about today? So we're going to talk about everything and anything low back. So if anybody's got any questions, I'll have some time at the end to talk about that. And just think about as we go through and as I go through and I talk about sciatica, low back pain, and DDD, or degenerative spinal disease. Just think about any questions you might have, and toward the end, I'll have a little Q&A session for anybody that has any questions. Okay. Okay. So who am I, right? So I'm Dr. Sean Lordan, and I am board certified in orthopedics through the American Specialty Board of Physical Therapy, and I went to Northeastern University and in Boston, and I own Concierge PT here in Sutton. And we've got a team of about 6 doctors of PT, and we're located in Sutton, Mass, and hoping to expand shortly to out to Westboro. So we'll have 2 locations, and plenty of doctors to help with your pain and potential problems. So what is in it for you? Okay, what are we here to learn about today? And what am I talking about? Okay, you're going to learn specific ways to manage your low back pain. Okay, you're going to learn about next steps, okay, in order to treat your low back pain and manage it from not only a 30,000-foot level, but from a ground level, okay, no matter how long it's been bothering you. 5 years, 10 years, 2 weeks. I'm going to give examples for everything. You're going to learn about a specific examination technique that we employ here at Concierge, and how it'll help define your specific low back pain. And we're going to give you a chance at the end to learn about how you might have the opportunity to work with me or one of my doctors in order to get you more personalized advice. Low back pain is an epidemic, and it's getting worse. So I understand that currently we're going through a different type of pandemic or an epidemic, but low back pain is the leading cause, if not one of the leading causes, of disability and inability to get to work throughout the entire world. Okay. Almost half of the world is living with some sort of low back pain right now, which is incredible. 1 in 2 people. Almost all of us, so 80%, so 4 in 5 will get low back pain in their lives, okay? 1 in 5 will experience low back pain for the first time this year, okay? So that's a really powerful, those are some powerful statistics. If you look around you, and maybe you're working in an office with 10 other people, think about that. At least 8 out of 10 of those people are gonna get low back pain in their entire lives. So if not for yourself, this webinar will be a nice opportunity for you to learn a little bit more and maybe help some other people in your life, whether it's a friend or a family member, not only understand that low back pain pretty much happens to everybody, but how to manage it and how to deal with it without getting injections and taking meds and all this other, all the wrong paths to go, okay? Low back pain is associated with an enormous economic burden, okay? And by economic burden, I mean, if you can't work because you have low back pain, your family can't make money, and insurance bills rack up, and it's not a great scenario. Okay. Those who have experienced activity limiting low back pain, really so severe low back pain, see an increase in having that same back pain come back at a 33% rate. So if you bent and twist, let's say you were 25 years old, you bent and twist and hurt your back, there is a higher percentage that you will get low back pain again later on in life, to the tune of 33% higher. Okay. Those are the diagnoses of chronic low back pain. It just continues to rise. So in 1994, we had, and this is the world's population, so we had about 4% of the world's population had chronic low back pain, meaning pain all the time. Okay, not intermittent, but pain all the time. Okay, 2006, that's jumped up to 11%, and that's almost tripled. Okay, so we just see that we're working, and we'll talk about this a little bit later. Jobs, whatever job you work, that does have a high correlation with your chance for getting and having low back pain. So, we're going to talk through different types of jobs and whether it's a highly laborious job or if it's you're sitting all day. These are things that can really increase your chances for having low back pain. And we'll talk about ways to combat, if you do have a job where you're sitting all day, or if you're you're doing a highly intense job, how to fix, how to do some stretches and some exercises to make sure that you're not getting low back pain at a high rate. What does low back pain cost the average American? Okay, so this is a really fundamental question in society. Is in terms of healthcare, especially with deductibles rising and the inability to access a copay right away. We really need to be careful of how we're approaching the healthcare funnel. Where are we starting? Are we starting at a PCP? Are we starting at an orthopedic surgeon who might cost $500 for a consult? Or are we just starting at a PT who may cost $160 for a consult and $80 for 5 visits, and you have a solution, versus going to an orthopedic surgeon who says, "There's nothing I can do now, just try some PT," but then you're out $500 just to get their opinion. Okay. Low back pain is a multi-billion-dollar industry. In that industry, we include TENS machines, we include medications, we include surgeries, we include the tools they use for surgeries. Okay, all of the above. On top of that, the salaries of all the surgeons and doctors and medical assistants and front desk agents involved. It's a super high. It's a very busy industry. Okay, so I'm here to help simplify it for you. Fusions and laminectomies, so these are the most common low back surgeries, can cost upwards of $50,000. And the crazy part is they're not clinically proven to be any better than PT. We look at 5-year outcomes of patients who get a laminectomy, a lumbar laminectomy, and a laminectomy is just, pretty much to oversimplify it, it's like a rotor-rooter to your low back. They find the spinal canals that are just busy with arthritis and just that are clogged up, and they rotor root through it and they create more room for the nerves to go. Okay. Sometimes your symptoms, in order to get a laminectomy, you may have really bad numbness and tingling down your legs. You might have severe pain. You may have saddle anesthesia, meaning that your butt is numb. You can't feel a toilet seat. You might be losing bowel or bladder sensation, or you may just be losing urine a little bit. So these are indications for those surgeries. But believe it or not, and especially we've got here at Concierge, we've got 2 PTs that are certified in women's health. We want to look at everything, including the core and the way those muscles are firing. And we've got, believe it or not, we've got tools that can actually go inside and tell how the pelvic floor is firing and how those muscles are firing, and if they're firing, so that you can maybe put off some of these not only dangerous surgeries, because there are a lot of side effects with surgeries too. You talk about blood clots, you talk about potential paralysis. Nobody wants to talk about that, and there are low rates, but that is a risk. Anytime somebody's cutting you open, there are risks. Okay, so you've got to be really healthy and active, and especially going into this thing, you want to make sure that you're doing everything you can to avoid going under the knife. Okay, it's not always the solution. And I can't tell you how many times in the clinic, just from anecdotal experience, I've had failed fusions, I've had failed, laminectomies, discectomies, and the whole goal was, the thought process of the patient going into it was, well, I'm bone on bone, so what is it that a PT can do? Well, the answer is there's a lot, because everything the PT does is we work, if there is stenosis, we work to gap the joints and to open up that space. Okay, and then we work to fix the root cause, which is tight muscles around there, in order to fix the problem. Okay, understanding the way pain works is also a huge, um, is also a part of the whole picture. And with your low back, it's a little bit more complicated because your discs are innervated. They get their nutrition through it's through osmosis, right? So when your discs are loaded up and down, that's how the nutrition drives through the vertebra through the end plates into the discs. So this motion is really actually good for the disc. Okay, that's driving nutrients into it. Okay, when you bend and you rotate, that's how the disc tears. So if you bend over and try to pick something up like a 50-pound box off of the ground, and you're bending at your back, meaning you're not using your knees and your hips, and you're twisting, your spine just from a physics perspective, it's just not a strong, it can't support that type of motion. And that's where your discs they'll tear. Okay, when your discs tear, and I'm going off on a little tangent here, but when your discs tear, what happens is blood flow comes in to heal that tear. And with that blood flow, there's neogenesis of nervous tissue. With nervous tissue, there's pain receptors. Okay, so now as the tissue heals, as that disc heals, it's now got new pain receptors that anytime you move and twist, you've got pain receptors where there previously weren't pain receptors. Okay, or as many pain receptors, I should say. So that's why low back pain quickly becomes chronic, because as the pain receptors continue their process of replicating, because when you bend and twist and the pain receptors continue to multiply, that's why the pain gets chronic. Okay, so what we need to do is make sure that we're hitting that inflammation and that process at its root cause, maintaining appropriate muscle length and improving strength in the low back. So you're not getting those symptoms all the time, because when you get the symptoms all the time and you're living with it daily, then there's a neural feedback loop in your brain, and your brain starts to tell you, okay, this low back pain is normal. And that's where we've got to cut it. We can't continue. Once that cycle hits the brain, it's a dangerous phenomenon. So we really want to encourage getting in to see a physical therapist as soon as possible, so you're moving properly. And if you're moving properly, that pain cycle is going to be cut, so that doesn't become a brain neural loop. Okay. So again, when you talk about the cost, back to the cost, it can cost you. I mean, most people have a max out of pocket in their insurance plans of between $11,000 and $15,000. Okay, these surgeries, you get a spinal fusion surgery, you're going to hit that $11,000 or $15,000 out of pocket max, no problem. And that means that you're out of pocket almost $15,000 for that $50,000 insurance, for that $50,000 surgery. So it's not free. It's not even just covered up to the deductible. Yeah, they're going to charge everything they can all the way up to that max out of pocket, because that's how these hospitals work. Never mind the opportunity cost of not being able to work for the next 3 or 4 months, potentially 6 to 9 months, right? So if you get a fusion, it's a really complicated fusion, you can't go back to work the next week. You're going to have to be in physical therapy for at least 3 months. And never mind, you might have a small stint in a nursing home, or, well, not a nursing home, but an acute rehab, potentially a skilled nursing facility, depending on your level of ability. And it can get really expensive really fast. And not only, I just really want to stress, it's not only the cost of the surgery, it's the cost of not being able to work or do anything because of the debility from the surgery. Okay. All the more reason to do something about it today. Who does it impact? Okay. So low back pain tends to hit women a little bit higher than men. Okay. Increased age is associated with a higher prevalence of low back pain. And when you think about it, that makes sense, because arthritic low back pain, degenerative low back pain, stenosis, which is kind of bone on bone or created bone at the prominences, the facet joints, that happens as we get older in age. And that's just a result of posture. And it's a result of your discs. They lose their aqueousness, or their water content, over time. Okay, so as the discs lose their water content, the spine starts to shrink. So if you think about, maybe your parents, for instance, right? So if your parents are in their 70s like mine, my dad used to be 5'11" and a half. He's now 5'9", and he's only 72. So he's already lost 2.5 inches, and it's not just because his spine is a little bit more flexed, and that plays into it too. It's that his discs are losing water. Okay, so that, that'll play into. That's why you see a higher prevalence of low back pain with increased age, because the closer the spine joints get together, then they start to rub on each other. When they rub, it's a Wolff's Law. It creates more bone, and bone on bone, that's not a fun situation, because when there's bone rubbing on bone, that's what creates the pinching and the pain, and an inflammation kind of starts to sit around those capsules, and then it's just it creates a pain cycle. So that's not fun. Okay. So more severe forms of low back pain continue to progress with age. And again, we talk about compression fractures. That's another severe form of low back pain. And compression fracture is just, and that's obviously more prevalent actually in white women because of bone density issues. White women, Caucasian women are more likely to have osteopenia and osteoporosis. And especially, I would say 50 plus population. So you tend to see compression fractures there, and that's just a fracture of the vertebra, the vertebral body. And so any flexion or really extension, any sort of movement can really hurt. Okay, and you tend to see those, in the thoracic spine. So you see it at the junctions. So where the curve is in the thoracic spine, you'll see it at T10, T11, T12. You'll see it T6, T7, T8, right where the apex of the curve is. And sometimes you'll see it a little bit higher, T1, T2. But those tend to be really painful, and there really isn't a great way to treat them. Okay, so we've got the surgeons can go in, or even maybe physiatry can go in with a cement type compound and kind of fix the fracture a little bit, or just support it. But again, I mean, just knowing about it is the most powerful tool. So you can help regain your mobility today, so that you don't turn into that, create that kyphotic type posture, which will eventually, increase your risk, that severe form of low back pain, which is a fracture in your spine. And again, it's insidious. It just happens over time. But one morning you wake up and your back is killing you. And then you go to the doctor says, oh, well, let's just get an x-ray of your spine. They see this compression fracture. And as doctors, we typically associate fractures with trauma, but this is just a postural trauma, which is incredible. That's how powerful your posture is. Okay. Those with a high school diploma or lower tend to have a higher incidence of low back pain, increased prevalence, and they typically have longer episode duration and worse outcomes. So who's getting treated and who's getting bad advice? Okay. This stat is just bewildering. 7% of those who go to their primary care with low back pain get referred to PT. 7%. So 7 out of 100 sufferers from low back pain will get the solutions that they need from a specialist of PT or even chiropractic, right? I think chiropractor has a lot to offer patients as well with mechanical low back pain. But what are those other 93% of people getting? That to me is scary. So are they getting a script for OxyContin? Are they getting an x-ray and then sent home with a sheet of exercises? I don't know what's happening, because they don't come to me. So if they came to me, I would look at their posture, I would look at their whole body, and do my typical concierge approach and look and see where the root cause of the problem is coming from. But we wonder why there's an opiate epidemic in this country, when 7% of people who are having low back pain are getting sent to somewhere where they're going to get a solution. So where else do they have to turn? Rest and painkillers is clinically proven not to work. It is just not going to work. In fact, I would go so far as to say and there's studies that show this, those who are afraid of moving and just want to rest have way worse outcomes than those who are willing to take the next step and start to move, even though they have pain. And that's something, again, you want to work with your physical therapist to do the right exercise and the right movements. But if you rest, your muscles, up to 25% of your muscle mass can atrophy within 1 week if you just lay in your bed and do nothing. 25% of your muscle mass. That could take you 3 to 4 months to rebuild. So if your back is killing you, you have to spend a week on the ground, you could lose up to 25% of your muscle mass. So just think about that. That's why it's so important to have a solid exercise routine, even if it's just a couple days a week, even if it's just walking, a couple exercises done by that you got from your PT. But just please, if you get a sheet of exercises from your doctor and it's on a a grayscale piece of paper and they look like stick figures from 1982, just throw it away and call a PT. It doesn't it doesn't have to be me. Just call somebody who knows what they're doing. Okay. Um, Cortisone shots, meds. Again, I mean, the cortisone shot is great for inflammation, but it's just masking the problem. What is the root cause of the problem? Who is putting you through a mechanical movement exam to see where the pain is coming from? Okay. Super poor correlation between imaging and what's actually going and symptoms for low back pain. What's actually going on, right? So you could have the world's worst herniated disc on an image on an MRI or a CT scan, and it could have zero correlation with your actual symptoms. And that's frustrating for a lot of people because what do we want when we go to the doctor? We want a diagnosis. Sean, I just want an MRI. I want to know what's going on with my back. Well, Mr. Jones, you're getting back pain because your posture is terrible, your hips are really, really tight, and your low back isn't moving. So we need to get it moving, and also not for nothing, but your gait is off. You have no stride length. You've got no abductor strength in your hips. We've got to work on everything in order to get rid of that pain. It's not just the fact that you have a herniated disc. That's not causing all of your pain. Okay. What does big pharma not want you to know? Okay, so big pharma and opiates, obviously it's been in the news for the last really 5 years or so. Big pharma has been a big pusher, and now they're kind of owning it about the opioid epidemic. A lot of the problems they've created, but people are stuck on these pills. Okay, and all it does is it masks the pain and symptoms at the neural level. Okay, and it kind of gives you a little bit of extra. You have less fear of movement because it's masking the pain and the symptoms at your brain level. Okay, so I would much rather have somebody take an NSAID or something that's not non-narcotic, an NSAID that actually hits the inflammation, or a cortisone shot, because that's actually hitting the pain at the root cause. Okay, so unfortunately, big pharma in the United States, at least, tends to capitalize on your pain. Frankly, it is easier for a doctor to say, okay, here's 2 weeks of 800 ibuprofen and some exercises, try that, instead of just saying, hey, here, go see Sean, he's a specialist down the street. Okay. Much easier to just give a pain pill. They've got 15-minute appointment slots. Maybe they'll schedule for an X-ray or an MRI. But typically an MRI is not something at the primary level they're going to give you right away if you have low back pain. It's going to be an X-ray, see what's going on, make sure it's not cancer or anything pernicious, and, either send you hopefully down the street to PT, but now we know that's only happening 7% of the time. So again, what's happening to the other 93%? I can only assume. And I hope that it's not a narcotic prescription, but I can guarantee you that at least at 1% level, it is. Okay. So the US healthcare system, again, it's just not working optimally. Typically, if when I tell my patients is, thanks, I'm so happy you chose me, but really PTs should be the primary care provider for anything musculoskeletal. If you have neck pain, shoulder pain, low back pain, go see a PT directly. You don't need a referral to see a PT. 99.9% of insurance companies will not hold a referral over your head if you need to go see a PT right away. So, and at least at my business, the front desk just calls the primary care, they send it right over. It's not an issue at all, ever. And we call that direct access, and that's state law, that you can just come right to a physical therapist, and we can diagnose your pain problem, okay, your movement problem. And again, if we think there's something red flag wise going on, if we feel as though there's cancer or something, really suspicious, we're going to send you back. We work with your primary care and, many orthopedic surgeons, at least in this area, and we want to make sure that you get a salubrious and a healthy outcome. And that's, we need to look at the big picture too. Working with rheumatology, we work with all different departments, but, you are the client, you choose, you can hire and fire as you please. If I'm not doing a great job, fire me, go somewhere else. But my job is to work with you and surround you with a team of folks that can help solve your pain problem and your activity problem. And again, I don't need to mention this, but holistic care, prevention, nobody talks about that. And that's primarily why the US healthcare system is, in my opinion, broken, because all we're doing is fixing symptoms. We're not doing anything to help prevent the symptoms in the first place. There's no holistic approach to healthcare, nutrition, any of that. There's nothing. Where's the education? We're not providing it to our kids in the school systems. And as adults, what are you forced to read? Men's Health and Prevention magazine for nutrition? I mean, where are you getting nutrition advice? Then who's to say what's right and what's wrong for you? Okay. So again, all the more important to have a team of specialists and somebody who's looking at you from 30,000 feet with an actual hour to spend time with you, to be able to ask those questions too. Okay. Okay, so I've just got to talk about this, and this is just, I'm not going to spend too much time here, but it's something that drives me wild. The cookie cutter PT clinic, okay? And I get this all the time, and it's typically, it's always somebody who still has pain, and they've tried PT before and it doesn't work, and I usually ask, have you tried PT anywhere else? And they say, okay, so what happened there? What did they do? Well, I went 3 times, and they gave me, it was all exercises, and I said, well, how long did they see you for? 30 minutes. You can't get anything done in 30 minutes during a physical therapy session. Maybe if you have to go in there and it's just hands-on, and you got to do it quick, that's one thing. If it's a session here or there that's just hands-on, or we're just trying to get you out of an acute exacerbation, that session might be 20 to 30 minutes and some ice and stim. But if you went to PT and they just put their hands on you for 5 minutes, maybe did a little rub here or there, and then it was 20 minutes of stretching and a home exercise program, and you're out of there in 3 visits, that's not physical therapy. Okay, that's crap. So, or if you were my favorite is, oh, they used the ultrasound wand and they ultrasounded my, my butt and my back for about 10 minutes. And then they rubbed it for a little bit and handed me an exercise sheet, and I was good. Not PT. Okay. I got an exercise sheet from my doctor. Okay. And I did all those exercises. It's not going to help. Okay. How do you know you're doing the exercises properly? Is there somebody there showing you how to do them properly? Because when you're in acute low back pain, if you're not doing an exercise properly, you're probably going to make it worse. And you're going to be picking up the phone, calling the local chiropractor or whatever you have to do, because you don't know what your problem is to begin with. Okay. These things just drive me wild because it's just bad for the profession. Okay. If you're at PT, you look to the left, you look to the right, and everybody's doing the same exercises. The bird dog, the clamshell, the bridge, okay, the prone press up. These are important exercises, but if everybody is doing them at the same time, does that tell you you're getting individualized care? No. Okay, so you're going to get a gut feeling as soon as you walk into some place, whether it's the right place for you or not. And I would go so far as to just at least go through the evaluation. And, it's just so important to have a good rapport with whoever your physical therapy provider is, because you're going to be asking them a lot of questions, and that relationship just really has to be good in order to progress well, because it can potentially be a 3 to 6 month treatment plan. Not that you're going to be in PT for that entire period of time, but you might be sending your PT an email 6 months, 6 months in the future, and your PT, you want to have a good relationship. It's really important. And I stress that with my staff to really keep in touch with their patients and, be empathetic. So if you find one of these cookie cutter PT clinics, run. Okay. And if your doctor tells you you have to go to one of these places, fight them, because you can go anywhere you want. It's direct access. At least in the state of Massachusetts, you can do whatever you want. Okay. What are they missing? Okay, so how come 5 minutes of rubbing and some ultrasound and some stim and a couple exercises, why doesn't that help? Okay. Well, the real problem is because nobody's identified what the actual problem is. Okay, so you might have diagnostically a degenerative disc disease or a spinal fusion or a laminectomy. That doesn't mean anything to me. I don't care about any of that. What I want to look at is, how is your spine moving? How is your body moving? Because you're going to have pain doing things. You're not going to have pain in isolation, just lying on your back. You may, but that's because we haven't looked at what's going on and why things aren't moving properly. Okay. I can say this because I've been in the field for almost 15 years now, and I own a practice, and I've seen a million patients. Connective tissue, which is the tissue that's right on top of the muscles, is just really complex. It is so complex. It goes all the way from the back of your head, all the way down your spine, and the same thing all the way up at the front of your body. It's all connected. Every single bone and joint and muscle in your body is connected through a tissue. We call it fascia, but through a fascial highway. Okay. There can be trigger points potentially in the bottom of your feet, or in your calves, or in the front of your shins, the anterior tibs, that are, if hung up and not addressed, will cause movement impairment in your spine. So just let that sink in for a moment. Your calves, if tight, may cause movement impairment at your spine. So if you went somewhere, they didn't look at your whole body, you're not going to get the solutions that you're looking for. Okay. We need to identify where the muscles are tight and the connective tissue is hung up. We need to use any sort of tools in our toolbox: dry needling, Graston technique, spinal manipulation, exercise, stretching, hands-on, massage, whatever it is. I don't care what we use. Whatever it is, we've got to use it in order to help release those trigger points and get some normal flow and elasticity back to your muscles. Total body approach is the only way that you're ever going to fix low back pain. Okay. And again, I would be remiss not to mention other things affect low back pain too. Okay. So stress, your diet, your activity level, hobbies, it's just so important. That's why you need time. That's why your doctor or PT needs time with you to develop a particular plan, a tailored plan to you, to help you get the results that you're looking to get. So let's say you golf or play tennis. We're going to be doing different exercises as the treatment plan progresses in order to get you back to doing those exercises. We're not going to be doing exercises to get you back to swimming or something you don't care about. We want you to hit the goals that you're looking for. I love this one. So why should I trust you? Right. So what do I know? Well, I've been around for a little while. I own an orthopedic practice, and I regularly contribute to podcasts. I'm an author, board certified in orthopedics, in Massachusetts, I think there's less than maybe 100 of us right now who are board certified in orthopedics. And to give you an idea, I think there's about 20,000 PTs in Massachusetts. And again, I've worked in hospitals, I've worked in acute care settings, which is right after the hospital, really the hospital. I've worked in subacute settings like a Braintree rehab, where people are typically there for a week or two. I've worked in the skilled nursing facilities with really, really sick older adults. I've worked home care. So I've seen patients go from getting a spinal fusion surgery immediately home, and then bridging that gap to outpatient PT, which is currently the location that I'm in now, and the clinic that I own. So yeah, that's a little bit about me. So I do know a little bit about low back pain and what's going on. Let's just dive into the risk factors a little bit here. Okay, so two different types of risk factors that I look at for low back pain, and the main types are what's modifiable and what can't be changed. Okay. We were talking about this earlier. Jobs with a higher physical demand, you're going to have higher low back pain. It just is what it is. So if you're bending and twisting all day, you're working at a factory, you're working at on a conveyor belt, and you're doing the same repetitive task all day long, you're going to have a higher risk for low back pain just because your muscles are constantly going underneath the same tension sequences. Okay. So it's something I'm going to ask about and we're going to look at. Let's say you're an Uber driver, or you're a taxi driver or a limo driver. You're sitting all day. So we need to do exercises to help counter that. And if you're not, nothing's going to change. This is a really interesting one. So, and this is something people ask me, when I'm out all the time, am I done for because my dad had degenerative spine disease? My dad had a bad back. My mom had a bad back. Am I toast? Am I done for? And the answer is really not necessarily, because now we know so much more about low back pain in 2020 than we did even, 10, 15 years ago when I graduated. We're finding that, the more you do to help stay active, uh, it's just, there is certainly a genetic component, and especially with some of the other, there's ankylosing spondylitis, and there are certainly some bad, spinal diseases that have genetic drivers. But in general, if you have a good diet, you're not doing a job where you're constantly bending and twisting, you're well educated, and socioeconomically you're doing okay, you're going to make better decisions when it comes to your health, and understand a little bit more. So there is a relationship between genetics, body build, and early environmental influences, but you're not toast if you know just because of your genetics. So just do whatever you can uh, in terms of stretching and staying healthy and eating well. And by eating well, everybody's different, right? So the big thing is lactose free or gluten free and dairy free diets now. That's just what it is now. But I would tell you to consult. I love Valerie Fagali. She's phenomenal. She's I can put her information maybe at the end of the webinar here, but she's just a phenomenal nutrition coach and doctor of physical therapy as well. But she's done some great work for my family, and just in terms of just a needs analysis and looking at all the different modifiable risk factors like stress and everything else, sleep. Okay, all of these things, they have factors when it comes to chronic disease, any chronic disease, but especially low back pain. Smoking over, and obesity are obviously, two modifiable risk factors. If you don't smoke and you control your diet, you're going to have less of a chance of having sciatica. And sciatica is just referred low back pain. So that's pain down your leg. And it could be, two different causes. It could be just a pinch down the pathway where that sciatic nerve goes, or it could be a pinch proximally, at the level of the spine. So could be just a muscle kind of tightening, the piriformis and the sciatica. That's less than 5%. Typically, it's coming from your low back. So with sciatica, and that's commonly everybody WebMDs their low back pain if they're getting referred pain. So referred pain, I'm talking about numbness and tingling down the leg. Everybody comes and they say, I've got sciatica. And I say, okay, well, let's just look at a couple different things. And 95% of the time it's coming from the low back. Okay, so what we do is we loosen up. There's a series of nerve glides that we call them that help loosen up the nerves and get rid of that sciatica. Okay. There, as I was talking about earlier, again, the spine, when they come in and they say, I need to get an X-ray, I need to get an MRI or a CT scan, I need to figure out what's going on with my back. Again, there's very poor correlation between what they're finding on an X-ray or an MRI and what's actually causing your symptoms. And the reason for that is because an MRI just shows you the anatomy. It does not show you where the inflammation is. It can show you a little bit, but just in those areas. And it doesn't show you which muscles are tight and which muscles are weak. And that's what's causing the problem. So it's great to have that if they're going to do surgery, because they want to know which disc to operate on, but it doesn't necessarily help us in the PT setting. I have a herniated disc. What now? This is my favorite question. So it's one of the most common forms of low back pain. Typically when folks come in, they have a herniated disc, they have pain with bending forward, or they're hitching when they're coming up, or they have to walk their hands back up in order to stand back up again. Typically 25 years old or beyond. I'm not seeing a herniated disc in an adolescent. And usually what I'll say is if they're in an acute stage of exacerbation, the first week or two, I'll recommend NSAIDs. So I'll recommend, a dose of 800 milligrams of ibuprofen or Motrin. Okay. But again, that's just for 2 weeks. Okay. Control the inflammation and then slowly introduce pain-free exercise. Might be sore at first, but we got to get the spine extending again, because what do we want to do with that disc? We want to push it as we extend the spine. We want to push it back into place here. Okay. So it's just going to pinch back into place. We want to loosen up those hips. Okay. If your hips are tight, where are you going to get your mobility from? If you need to bend and twist, you're going to get it from your low back. So if your hips are tight, your hips are responsible for flexion or bending. And for, when you bend forward to pick something up, you're getting that at your hips and your knees. If you're bending your spine, it's going to put a lot of pressure on those discs. So we need to have nice and mobile hips. Okay, so this is a great exercise here. How many times, how often? So if you've got an acute flare-up of low back pain, we want to be doing it 10 reps on the hour, every hour. Okay, if you've got, and that's specifically for the herniated disc. You know, sometimes I'll even go so far as, you know, if you're working from home, lie on your stomach and just do some documentation with your laptop on the ground. So we call that prone on elbows. Pain should be better by week 3. Function should return by week 6. Okay, and again, if you get a herniated disc and you don't have a relationship with a PT, go find one in your area, because that's really important. And find a good one, not a cookie cutter. Okay, osteoarthritis, degenerative disc disease, degenerative joint disease. And what's the difference, right? So to me, I bundle them all up because really they're all a product of an active lifestyle. Okay, so probably a little higher risk if you're obese and if you're a smoker for getting all of these, right? Because again, smoking and obesity is going to reduce the height of these discs, which is going to, again, as the spine becomes closer here and bone rubs on bone, it propagates more bone, which you're going to get that DJD. Okay, degenerative disc is the same thing. If it's not properly hydrated because you're not drinking enough water, it's not healed well, you know, you're going to have pain there. So I almost never show patients images like this of the bulging disc because it's just, it's bad for patient education because they see this and they think I need surgery because the only way to do it is to snip it out. It's not true. If you extend your spine and do those press ups and do the extension exercises with this is a herniated disc, you can push that bulge back where it belongs. Okay. There's going to be inflammation in here in the meantime. How do we hit the inflammation? Well, we do 2 weeks of ibuprofen, not 10 years of opiates. Okay. Don't mask it with pills. Treat it with NSAIDs. Move. Get walking. You know, do some pelvic tilts. Do some hamstring stretches. Do the basic exercises that are going to help your spine. You know, anytime your spine moves, it's good for your body. You know, we don't want it to be painful. We just want to do some gentle exercise that we can get some healing factors back into that area. We want to stay hydrated. Okay. We're to do these moves. So a lower trunk rotation, a pelvic tilt in supine, and walking. So these should be on my, if you go on the website and download the low back pain report, these exercises should be on there. Obviously walking is walking. It's starting to get cold out. So just do what you can. I mean, if you get a treadmill at the house, great. If not, you know, it's good to get some fresh air too. Just bundle up and, you know, start with a short walk. You know, and if you feel like you've got a shuffling gait, just be very careful in the winter. Don't want to have any falls. Okay. Weight bearing exercise and osteoarthritis. So it's great for osteoporosis, osteopenia, but it's also great for the spine in general. And again, we need to get to the point where you're not having a ton of pain. So weight bearing exercises can be great to help reduce pain and inflammation, but only if you're doing the right exercises. Why am I so stiff? My back is just stiff. It just seems like I can't move it. Do I just need a massage? 99% of the time, every eval that comes in for the low back, it's stiff. I just need a massage. I'm telling you, massage may help a little bit, but it's just going to help your brain feel better. It's not going to help your muscles and your joints heal. Okay. So the specific muscle groups that we need to target are the piriformis, the glute med, the hamstrings, the calves, really everything on the back of your body. So we need to loosen it up. So when you bend, those muscles have good pliability and flexibility. You're not bending from the spine. Okay. So that's the first thing that I address. I don't rub I will, you know, massage and maybe manipulate and work on your back. But the first thing that I'm going to do is look at your whole posterior chain, which is, you know, from your plantar fascia up, your calves, hamstrings, glutes. Got to get everything moving. Okay. This is a cup shown here. We do cupping here at Concierge. But again, I just really want to stress, it doesn't matter what the technique or intervention is that we're using. What matters is that we're doing whatever we can to loosen up the muscle tissue. Okay. So cupping is one option. Dry needling, you go with the needle, you twist it, you stretch it, that stretches out the muscle tissue. Got some pretty good results at the low back with the dry needles. This helps loosen up the muscle tissue a little bit and can cause it can get into those deep trigger points, which you just can't seem to get with your hands. So drenuling is pretty good. But again, just please get some professional help. I mean, PT, I feel as though PT is a wonderful solution because it includes, if you find a good PT in a good clinic, good PTs should be able to do spinal manipulation. So if they can combine spinal manipulation with cupping and Graston, which is the tools, the scraping tools that don't feel wonderful, but they get the job done, they get results. That's what you want to find. Don't go somewhere that's just going to rub your muscles because it's going to be a waste of money. Okay. Is there a long-term solution for low back pain? Okay. So really the question is, that's a great question. And it's so hard to answer that because it's person to person. Okay. But really the point of this, the point of talking about this is you have to be seen. You got to get in order to get your body looked at. And, we want to make sure that we're doing due diligence and truly doing a full body exam and figuring out what's actually going on. So there's a study done by Gellhorn who looked at Medicare patients, which is 65 plus generally. It's not always 65 plus, but in generalities. When a patient with Medicare saw PT within 4 weeks of initially getting low back pain, they were way less likely to have a cortisone shot. And they were also less likely to continuously follow up with their doctors than those who waited 3 months thinking it would just go away, right? And we're talking about that back pain that's like that nagging 4 to 6 out of 10 pain that's just, it's dull, it's achy, potentially it's sharp sometimes when you bend or twist, but it's bothersome enough that, you had to go to the doctor in the first place. So got to get to PT right away. Okay. And I'll talk more about that in a minute. So early PT will also help reduce the risk of conversion of people with acute low back pain. And acute, we talk about 0 to 3 weeks to patients with chronic symptoms. And chronic can be a lifetime of low back pain. So again, if you see a PT right away, they're likely to fix your acute problem and make sure you don't get a chronic problem down the line. And again, a lot of that has to do with the nervous system chemistry too, and the substance P and everything that comes from that pain feedback cycle at the low back. If you don't get that under control soon, it develops a neural loop, and that's really where that chronic pain starts to really take hold. We don't want that. Got to get hands-on therapy. Okay, can't just be exercises. As much as you just want on YouTube what exercises to do for low back pain, got to get some hands-on and really identify the trigger points in the spots that are tight in your body to get lasting results. Is there a subgroup of patients who will get a miracle type result from physical therapy? There is. It's not everybody. Okay, so I really want to caution you on this. Even if you fit all of these criteria, you still may not get the result that you're looking for. This study was actually done on military age males. So this, they're starting to kind of poke holes in it a little bit, but I'm going to talk about it anyways, because it is still powerful for that age. So, and again, so I'd say 20 to 55-year-old male for this. People who've had low back pain for less than 2 weeks, we'll say 2 weeks, 16 days, 2 weeks. No symptoms distal to your knee, so no numbness and tingling below your knee. Might have something into your butt or maybe down the back of your leg a little bit, but as long as it's not below your knee, you're good. Your low back is tight. I can't push on it well with my hand. At least one of your hips has more than 35 degrees of rotation in a certain direction that I know you're not going to know anything about. You're not afraid of moving. Okay, the FAB-Q, this is work. Okay, that's a sub test, but the FAB-Q, it's a fear avoidance belief questionnaire. So sometimes I hand some patients, if I really feel like they just don't want to move and they're scared, I'll hand them a quick FAB-Q, and the FAB-Q just asks questions like, do you fear that if you move your low back pain, it's going to go out on you and you're not going to be able to work, and it just very, do you feel like it's inhibiting your everyday life, and it just, if you move, is it going to create a huge problem for you? So we want to make sure that fear is normal, and I think that's important to recognize and to empathize with, but you just have to trust your provider that whatever they're doing is meant to help you. Okay, and you've got to try some exercise, otherwise it's never going to get better. So those who don't have a lot of fear with movement, those who've got good hip internal rotation, a tight low back, no symptoms below the knee, and it's really, you're still in an acute phase and it's not chronic. If I manipulate your back, which is a chiropractic technique, but if we do it as physical therapists, everybody in my clinic can do it, you've got a 95% chance that PT will help your problem. And that's some really powerful stuff. When we're talking about going from that 4 to 6 or that 7 to 8 out of 10 pain down to a 0 to a 1. That is powerful. Okay. So that is that. I'll just take a moment to just talk about, our clinic a little bit, and, how you could potentially work with either myself or one of my doctors, and really what sets us apart. And really what sets us apart is, number one, we make the time for you, right? So if somebody is really struggling, you're in a ton of pain, my PTs will stay late or come in early to get you in. So we're happy to say we do offer, 24-hour appointments whenever available. We try to get you in the same day, the next day, especially if you're really suffering. We go above and beyond to get you in. The next piece is, you've got a personalized treatment plan by a doctor of PT here at Concierge. We don't have it's all doctors of PT here. We don't use any assistants, anything like that. Your time is one-on-one with a doctor of PT. Okay. Appointments are typically for 45 minutes, between 45 minutes and an hour. And an evaluation is always an hour. And we pride ourselves on getting to the root cause of what's going on, not just identifying your symptoms. That's important, but fixing the root cause of where are the muscles tight, where are they weak, and that's what's going to help fix your low back pain for good, right? And we also work with your local PCP, your healthcare providers, in order to really figure out the best course of action for you, because it may be surgery. As much as we want to say PT is going to work, it might be surgery. Maybe you're too far gone. Maybe you tried 10 different PTs and finally came to us and you're feeling better, but you're not all the way there. That's a decision you want to make with a PT, because they're going to see you on the other side of it anyways. Okay. But we got a wonderful team here. And again, if you're still interested in learning more about what you can do to help your low back, there's a wonderful resource on the website just showing you some exercises. It's a low back pain free report. So if you just go to conciergephysicaltherapy.com, scroll down a little bit, you'll see all the doctors. So you can read about them and their biographies if you click on their faces. And then you can also just download the low back pain report, and that should give you some exercises as well, just to try. And again, you can always reach out to me. It's Lordan at conciergephysicaltherapy.com if you have any questions, or if you just like this webinar. I'm going to be doing a webinar on shoulder pain next month, and when we talk about all the different things, especially with the winter, with shoveling and everything, and seemingly a lot of folks get their shoulders done in the winter. So we'll do that. But yeah, let's just look at some of these questions here. So let me get out of the share mode and just look at some of these questions. I've heard mixed info regarding planks and lower back. What are your thoughts in general? Weight bearing exercises, are they good? How does that work if it's bone on bone? So good question. So planks need to be worked up to for low back pain. So I think that's a really important thing that we address, because if your core isn't strong enough to handle a posterior pelvic tilt or a hollow body hold, a plank, you're not going to be ready for a plank. You're going to start you'll hinge at different segments, and it's just going to be deleterious to your spine. So, my answer to that question is it really depends on where you're at in terms of the progression of exercise, because that's really important. Weight bearing exercises are great. So I would say that a safe weight bearing exercise for your low back, if you've got a physio ball at home, put one up against the wall, and you can just do some squats up and down with physio ball against the wall. Okay, that's a great exercise just for weight bearing. If that's too easy, you can always hold a kettlebell or a dumbbell for a little bit of weight added. And again, your spine should be straight when you're doing that, because you're using the wall to help keep your spine straight. Okay, so good question. Thanks, Richard. What else? Q&A. My posture's been bad my whole life. My chiropractor says I have to see her for adjustments just to keep aligned. So good question, Danny. So I think I love chiropractic. I think, I do a lot of their techniques, and I think given the right circumstances, a spinal manipulation is indicated. I think that when you manipulate a spine, that's the most ripe opportunity to then strengthen it, because now it's back in line, right? So if we can manipulate it, get it from here to here, and then we can strengthen it, then you're not going to go back to that pre-manipulative position, right? So that's the whole point of combining the manip with the exercise, right? And then also what happens sometimes, you can manipulate, but then the muscles, they're so tight that they start to, Danny, pull you back into rotation again. Okay, and we don't want that. So that's why we address, we'll do the dry needling, we'll do the soft tissue, and address that problem, the muscular problem as well. On top, the strength and the mobility on top of just the spinal manipulation is important. So, and again, when you ask what makes the treatment different, it's the combination of everything, right? So it's looking and addressing the root cause, which is musculoskeletal tightness. Where is the tightness happening? Which muscles are weak? Which muscles need to be strengthened? What is the impairment that's happening at the spine? Is it degenerative disc? Is it herniated disc? All of that. Is it a facet dysfunction? All of that contributes to what we're going to do in our treatment, right? So that's really important. And the book's going to be available shortly on Amazon. Yeah, thanks for asking. And people that sit all day, that's a great question. So sitting all day is bad for you on a couple different levels. And I would say it's probably worse for your neck than it is for your low back. Depends what the hard work is, right? So if your hard work is, you're working as a, even a truck driver could be considered hard work, and that's sitting all day, and then loading boxes. So that's probably, that's super high prevalence in that population. But, if you're doing a lot of activities where you're bending and twisting, or you're sitting on the ground a lot, so we see a lot of kindergarten teachers or, ABA therapists, things like that, people like that, who are constantly crouched over all day long and in a severe flexed posture. Those are folks that we really want to address the mobility deficits with right away, so that it doesn't get worse. Good. In terms of ibuprofen, so ibuprofen you just get at the drugstore. We recommend, if you're in an acute flare-up, definitely recommend doing 800 milligrams, which is what it's going to say in the back of the bottle, per day, just to get you out of that acute inflammatory stage. In terms of other drugs, Flexerol, we see Flexerol, we see, sometimes a prednisone taper for 5 days will help. We do that. We'll work with your primary care for that. They're the ones who are going to prescribe the Flexerol or the prednisone. So that's at the primary care level or at the orthopedic level. But that's typically, if your pain isn't abating and it's not getting better, and there's something, I feel like it's just too bad. We're talking about a 7 to 9 out of 10 level pain, then I would call your primary care and just say, hey, can we get Danny some, a prednisone taper? And 9 times out of 10, they're going to just send it right to the pharmacy. You'll be good. Cupping, yep, we do cupping. So, it helps. Everything helps. Everything's got a roll. Cupping is more superficial, just takes the superficial layer of the skin kind of off the body and loosens up that layer. Graston technique gets a little bit deeper, 1 to 2 centimeters, getting in, kind of scraping the tissue, loosening it up. Dry needles go a little bit further. They can go almost 6 to 7 centimeters into your glutes, 3 to 4 centimeters into your low back. So Graston's, dry needling is probably the deepest tool that we have to get to trigger points. In DDD, and again, so you've had DDD for 20 years, why does it hurt now? It's so dependent on, you could have done something you didn't even think about. Maybe you slept wrong, but your spine was already predisposed. Your spine is here. It's a little bit more congruent. It's a little bit more bone on bone. And all you had to do was bend and twist. The muscles weren't strong. And, now there you are with a little bit of inflammation, and the inflammation is what propagates the pain. So it could have been something you did a week ago, 2 days ago. A lot of times folks will come in and tell me, I don't even remember what happened. It just started hurting, just sore, this one day. And I don't even, maybe it was the gym, maybe it was this, maybe it was that. They can't remember what the mechanism was that cause the back pain. Obviously, get the diagnosis of DDD or DJD or osteopenia or whatever, but that doesn't necessarily, it could just be a simple, you bent and twisted the wrong way, and now you get some back pain. So again, that's why I would suggest just coming in or going to your local PT for a good consult and getting to the root cause of why are you having those symptoms? Is it inflamed? Do we need to address the inflammation first and then get you out of that 7 to 9 out of 10 pain? Or if you're in a 3 to 4 out of 10 pain, can we get you moving to then help you, improve your mobility and your pain levels for good if your pain levels aren't that high. So if your pain levels are between a 3 and a 5, you're going to be in a much better scenario to get really great results with PT right away. If you're at a 9 or a 10 out of 9 or a 10 out of 10 pain, it's going to be a couple days. We have to manage the pain cycle first before we can really get you going with PT. Good questions. What else we got here? Excellent. All right. Well, thanks everybody. Appreciate it. And thanks for your time today. And I'm going to send this email out to, or a copy of this out to everybody. And thank you so much.